How is everyone doing? All right, we're just sorry we're a little bit late today, but we are making sure that we have everything set up in order to serve you. So, hi everyone, I'm Carlina Rivera. I want to make sure that I'm looking at this, that I have the chat box up. Last time I did this, and I think we're still good. President of New York City Health and Hospitals on January 8th, 2018. Do you remember that, Dr. Katz? It was
I do.
Like your first day. So we both came in, but Dr. Katz has an incredible history in medicine, practicing and taking systems, specifically Los Angeles County, and really turning that system into something that had previously had deficit, that was looking at how to utilize their space more efficiently. And he did incredible things on the West Coast. He came back home to the East Coast. And now he's here directing the largest municipal healthcare system in the country. So of all the states in these United States, he's here with us. So Dr. Katz, thank you so much for joining us. I am incredibly honored. And I wanted to just ask, how are you doing and how is H&H doing?
Well, it's my pleasure to join you, and thanks for the pleasure of working with you in general these 2 years. It's great having you as the chair of the committee. So it has been hard, no question. Health and Hospitals, though, I think has done really an admirable job in very difficult circumstances. We had to triple our ICU capacity, which I think is pretty amazing that we were able to do that in a few short weeks. So on average, Health and Hospitals would have about 330 people in our intensive care unit. We had over 1,000, all with the same disease, COVID-19. But we didn't collapse. We were able to care for everybody who needed care. We didn't run out of ventilators. And not only did we not collapse, we actually took patients from other hospitals because one great advantage of this municipal system is we're an 11 hospital system. So we can transfer patients around when one hospital gets overwhelmed. So Elmhurst, which was really 0.0, got so many patients. A lot of them went to Bellevue because Bellevue is our largest hospital, has a lot of capability, but was not getting a lot of patients through the emergency room, fortunately. Other single hospitals are not able to do that, so we've been taking their transfers.
So, we actually have a transfer question here that I'm going to start with, and I want to thank everyone for sending us questions the past few days. I am not going to be able to get to all of them, but I'm going to try to go as fast as we can. Dr. Katz, his time is very, very precious. He is not only the CEO and president of Health and Hospitals, he also still practices medicine right in the Lower East Side. And so we want to make sure that he is rested and that he has time to address everything he can't do while he is on the ground and in our hospital system. So our first question, which has to do a little bit with transfers, and you touched on this briefly, is from Lois Utley, who is a great, great advocate and friend. How many patients have been transferred from H&H facilities to private nonprofit hospitals and ACS facilities? Can you offer a breakdown?
So to date, we haven't transferred any outside of Health and Hospitals. We have transferred over 500 patients within Health and Hospitals. So whenever a hospital would get overwhelmed, because there were a lot of cases in that area, we would move patients to other hospitals to accommodate them. We've had some wonderful stories like NCB, North Central Bronx, known as a wonderful hospital to have a baby. So we needed ICU capacity. So it turned out that the midwives all volunteered to work in the medicine wards, taking care of intubated patients who had COVID, because that's what the city needed and they were going to do it. So we've moved over 500 patients around our own system. We haven't needed to send any out, but we have taken patients from other hospitals when they need it. Jamaica Hospital, Flushing Hospital, as well as St. Barnabas Hospital, were all hospitals where we took patients from because they needed us and we were there for them.
Awesome. Okay. So we've heard a lot about the excellent work that Health and Hospitals is doing around telehealth services provided through 311. If you're experiencing COVID-19 symptoms and you're told via telehealth or in person at an H&H triage center that you do not need to be admitted at this time, when should you follow up on telehealth?
Sure. Well, that's a really good question. So I maintain my own practice now, which is mostly telehealth. And so many of my patients have had COVID and have been calling to ask. The most important thing is shortness of breath. When people are experiencing shortness of breath, that's a very worrisome sign. And we know that when people have shortness of breath, they can get worse quickly. So when I'm talking to any of my patients on the phone, I'm saying, do you have a fever? Do you have a cough? But the thing I listen most carefully is, are you short of breath? If they tell me that they're not short of breath, then I say, you will be most comfortable staying at home. COVID-19 has no treatment, right? We don't have any effective medicine. We're certainly trying, we're using drugs and studies, but at the moment, nothing has yet proven to be effective. So I say, stay home, be comfortable, isolate from your family, drink plenty of fluids, get a lot of rest. I think in general for viral illnesses, the body needs a ton of rest, and that really helps the process. Taking a lot of fluids helps to wash out infection. Um, so I'm a big believer in those things. When somebody has shortness of breath, that's a different issue. And then we want to see them. We want them to come to one of our emergency rooms or one of our clinics. And there, what we'll do is we'll check their oxygen saturation, which is the little meter. People put it on the finger. We read their oxygen saturation. For a young, healthy person, that should be about 98, 99, 97. As long as it's above 94, we're happy. But when people start to get below that, we want them in the hospital.
Do you give any different advice for someone? I realize that the shortness of breath is the number one thing that kind of alarms you as to whether or not they should actually enter an emergency department. But what about if someone is worried because they're asthmatic?
Right. So I think I certainly understand why asthmatics would worry more. And for my own asthmatics patients, I talk to them more often. I call them in the morning, I call them in the evening. How are you feeling? You feeling any different than you were yesterday? So I'm really trying to see, is the illness getting better? Is the illness getting worse? Where are we on the course of the illness? I do wish testing had been way more available from the beginning. And you and I have talked about that was a huge error on the part of the federal government. They sent out those tests, then they had to take them all back because they were contaminated. And had we had those tests in January and February, we would have never gone through the pain and agony because we would have known who was positive and who wasn't. So I do think that it's worth people getting testing. Right now, we are doing testing for people who come to the emergency room and are not short of breath. We have tents outside of our emergency room to do testing. And we've now opened up testing centers throughout the city. Anyone can call 311 and ask where they can go for a test. But we are focusing on older people and people with other underlying health issues, like you mentioned, asthma, because we don't want huge lines, right? The whole point is for people to shelter in place. We don't want people coming out for testing, and we certainly don't want elderly people exposed to a lot of other people in a waiting room. So we are asking people to please let older people and people with serious illness go first in the line.
And I heard the mayor say this morning that when who we're prioritizing are people who are immunocompromised, but also older adults over 65, more or less.
Yes, right. That's because consistently, whether in China, Italy, or here in New York City, it's older people and especially older people who have other illnesses who are at greatest risk from this disease.
And as you mentioned, we if we had the test earlier, we would be in a very different place right now. But H&H has opened 5 testing sites already. They're going to open 5 more. I spoke to one of Dr. Katz's colleagues, Dr. Ted Long. I speak to him once a week. He's at Lincoln Hospital in the Bronx. For the most part, he's doing mostly telehealth now. They were very hard hit, but he is absolutely dedicated to, as is all of the people at H&H, to increase testing sites. But testing sites are important, but what we really need are also supplies. And when we have the supplies for the testing sites, we will expand it exponentially. And H&H has made a commitment to go into the communities that are hit the hardest, because that is who needs the help right now. So I just want to thank you for that. So I'm going to go to the next question from Anthony Losquandro. Thank you for emailing. How is H&H defining elective surgery? And when will elective surgeries begin again at H&H facilities? For example, are New York City Health and hospitals performing infant circumcisions at this time?
Right. So we have canceled elective surgeries. That was part of the governor's order and something we did even before the governor's order, so we would have room. We are doing surgeries that are necessary in the moment. So if someone comes in with a high fever and pain in their upper right quadrant because their gallbladder is inflamed, that's a surgery we're doing. If someone has appendicitis, that's a surgery we're doing. We're not doing things like knee replacements. We're not doing arthroscopy. I know there is a sensitive issue around circumcision because circumcision becomes a more complicated procedure if you don't do it within the first few days of life. Right now, we're not able to do that, and I've been suggesting that people in that situation there are urologists who are willing to do the procedure at home with anesthesia. I hope that we will start doing elective procedures again sometime in May, but it's totally dependent on the hospital volume. I think right now we still have, as of today, we still have 800 people on ventilators due to COVID. Our peak was 950. So on one hand, wow, great progress. But on the other hand, that's 800 more patients with COVID than we had just 2 months ago. And that's just the number on ventilators. We still have 2,300 patients overall with COVID in the 11 hospitals.
But that number has gone down significantly from even just a few days ago.
Yes, yes. After every day being worse than the day before, starting at about 8 or 9 days ago, we noticed it flattened and then it began to drop slowly.
And this is for, as I've mentioned on other social media platforms, clearly, it seems like we've hit the apex. Numbers are plateauing. People are still intubated. Thousands of people are still very, very sick. If you could just take a minute and demystify, I think, people on ventilators, right? It's not just a day or two. It can be a week or 2 weeks or 3 weeks, and people do recover from being on a ventilator. Correct?
Yes, you have both parts right. So it's rarely a day or two, rarely. The usual course is that someone comes in, they're a little short of breath. We admit them because they're short of breath and we know that's the danger zone. And then over a series of days, about half of them who are short of breath get better and they just leave the hospital, never intubated, and a half get worse and they wind up being intubated. Once intubated, most people will be on the ventilator for 2 or 3 weeks. We have had extubations. We get very excited. We play all kinds of motivational music over the loudspeaker at each hospital. Each hospital got to choose their own song to play when somebody came off the ventilator. It's really important because we want people to experience the success that they've created. But sadly, there are people who die on the ventilator, and that's very troubling. We hope that there will someday be better treatments for people who get that sick.
And I think it's so important for morale, right? Want to make sure that everyone knows that the people that are in the hospitals, I mean, H&H has received hundreds of volunteers from across the country. There's military personnel in all of the facilities, and everyone is working as one. So I wanted to go back to testing for a second. I have a question here from Carol Doyle. What about the people who are homebound and cannot make it to a testing site, or seniors who are reluctant to or can't stand in lines to get tested?
Sure. Well, I think the right answer is clearly home-based testing, and I think we will someday be there. We're not quite there yet. I'm hopeful that there will be antibody testing available soon. Antibody testing will be a finger stick, so we won't even need to do the kind of blood draw that most people get, but it'll be more like a pinprick on their finger. We'll collect a specimen, and that will tell us whether or not people have been previously exposed. And that would be of tremendous value to us, because we think that if someone has already been exposed once, even if they were to come in contact with the virus again, they either wouldn't get sick or it wouldn't be a serious illness. We think being able to tell people that they have been exposed already and got over it would be a real shot in the arm for people. One of our challenges around the test, besides the short supply for the antigen test, what people think of as the nasopharyngeal or PCR test, is being negative today only proves you're negative today. It doesn't say anything about tomorrow or the next day. So it's not your ideal test, because especially at the time where there was so much COVID-19 being transmitted through the community, a single day's test didn't have much value. I'm hoping that once we get to a point where there is not a lot of transmission, then the test will be helpful. And then the antibody test will allow us to tell people, oh, you've already been exposed. You don't even know it because your body did so well with the illness.
Well, I got a question from Bonnie Stein, and she asks about remote testing that you can receive or do at home, and you covered that. We're not quite there, but soon there should be homebound testing, and we're looking at antibody testing that'll be a quick pinprick. But she asks, I got an email from an organization, not sure if it's legitimate. They said they were going to mail a home test kit. Is that possible? I would love to know if my early February flu symptoms were COVID.
So if my face disappeared, it's because my screen has automatic. If I don't touch it, it turns off. So it will become back, but I'm assuming you're hearing me, and I'm not that much to look at anyway. Okay, here I'm back now. So I would not send my money to that company, because many of the tests out there are no better than a coin flip. But your questioner still has a correct point, right? It would be worth it for her to know whether or not she's been exposed. I think that it's likely within the next week, we will have a test good enough that we'll be able to offer it to her and to other New Yorkers to find out how many people have been already exposed. And while exposure would not guarantee immunity, it certainly, I think, would make many of us sleep better to know, well, we were already exposed and our body did just fine. But don't spend the money on that. That test is likely a scam.
All right, Bonnie, good. She knows. So I want to ask, what H&H hospitals and facilities serve District 2? This question is from Kent Carell. Hi, Kent. Have they been getting all the PPE, ventilators, medicine, and other critical medical supplies and equipment needed so far? How do you expect supply lines to change going forward? And is there anything that we can do to help with supplies?
So the supplies is a fascinating socio-political issue. We saw in January that this would likely affect New York, and we put in orders for all of the supplies we would need, including more ventilators, more face masks. The orders were accepted by vendors, and then the whole supply chain collapsed. And what happened is that a variety of other countries had um, COVID outbreaks before we did. The supplies got diverted. People bid up the price. Suppliers gave it to higher bidders, and all of a sudden, we didn't have enough supplies, which I think should teach the US an important lesson about that it's great to trade and the global economy is wonderful, but you should maintain some capacity in your own country to develop these things. Doesn't have to mean that every mask has to be manufactured in the US, but you have to be able to manufacture masks in the US. You don't have to make every drug for every dose, but you should have the capability to make any drug that you need. Because it turns out that when you have to depend on a global economy and there are, political fights that are going on, and one of the things going on right now is that the Chinese government is holding back a lot of products. And I suspect it's partially because they are being blamed for the pandemic. And right. And so whenever there's blaming going on, it's not surprising that a country suddenly says, okay, well, maybe we're not interested in exporting these materials to you. So it's a complicated dynamic that we're living through. We never ran out of ventilators, and at this point we won't, because we go down every day now for the last 8 or 9 days. So we had enough at the peak. We have enough PPE to get us through the next 2 to 3 weeks. This is going to go beyond that. And so we're working very hard to try to source enough PPE. I believe we will succeed. I would feel better if I already knew that I had them, but I don't yet have them. District 2, Gouverneur falls into District 2, which is a wonderful center. That's where I practice. The hospital that is closest to District 2 is Bellevue, which is our flagship hospital established prior to the signing of the Declaration of Independence. We're very proud of it.
It has got an amazing history. And I would also mention one, I guess it's more of a, I don't want to say a Gotham clinic, but you certainly do support also the Roberto Clemente Mental Health Center.
Yes.
Which is a great local center that helps people with mental health issues, some incredible doctors and aides there. And so I wanted to ask about just mental health. You mentioned a couple things. So one about the supplies and the PPE. So we want to make sure, right, this never happens again. There are a lot of factors that go into why we have not received equipment, why we haven't received what we need. I also strongly feel, as many people understand, that the president has used this as a political tool, I think, to punish people and just not, I think, respond to people as efficiently and as quickly as he can. That's my own personal thing that I'm throwing in. But in terms of being able to manufacturing things here in the US at home in our backyard, I know we've seen about the Navy Yard kind of pivoting what they were making to doing manufacturing face shields and surgical gowns and masks and even ventilators that we saw on the press conference earlier today with the mayor. And that's really, really great. I think we have to continue some sort of, like you said, maybe not everything, but have the ability to do so. You also mentioned that this will go beyond 2 to 3 weeks. Everyone knows that we are on pause until May 15th, but most of us have seen that I think a wise choice was to cancel even June events. I think this will go well beyond May 15th, so everybody kind of stay ready. And it does take a toll. It takes, there's trauma that is going to have to be processed. There are many things that we'll have to talk through in terms of therapy. I want to ask about what kind of care is being provided to those with mental health issues in our hospitals during the pandemic.
Yeah, it's a great question. I think that people are suffering at every level. I think people who are not sick, who are at home, are suffering from terrible isolation, loneliness, separation from their families, anxiety because they can't exercise. There's nothing to distract them. There's no order to life, right? If you work is a great way of ordering yourself for many people, right? It's Monday through Friday. It's being at work by 8 or 9 o'clock. It gives the week a certain pattern, all the way to people who are very, very sick and worried, fearing death, people in the hospitals who have seen the death of their colleagues. This is one of the most horrific things. We've had nurses taking care of colleague nurses, doctors taking care of colleague doctors. Um, so, I mean, I think we want people to reach out. There are resources available through 311. There are amazing clinics. Roberto Clemente is a wonderful, wonderful clinic. I was so glad when you and I were together when they had the open house for the
Yeah.
new facility. Right, an amazing, amazing place. But even that, right? People, we're not encouraging people to go. Right, so the people are stuck in their house through 311. Anyone can talk to a professional counselor, not just as someone who answers the phone, but if you ask to be connected, they will connect you to a counselor who people can talk to, get support from.
All right, absolutely. So you can call 311. Also, our webpage on the council, we have a list of COVID-19 resources. We include a number of hotlines anyone can call, whether it's to just talk to someone, whether you are maybe a survivor of domestic violence, whether you're a veteran or a young person, tons of numbers there, an LGBTQ member. Just want to make sure that you have those resources available to you. So I have a question from Jake Wolf, who said, short of being put on a ventilator, what are some of the treatments some of the COVID patients are receiving at a hospital? What does the treatment plan look like? And are we able to treat this disease better than we were 6 weeks ago?
Oh, what a good question. I think a little bit better, but not wildly better. There are still no proven medications. We Most of our doctors are prescribing hydroxychloroquine, which is an anti-malarial drug. And because it's available, it's something that we can do. Um, but whether or not we don't yet have proof that it works. We're hoping it works. We're hoping it shortens the course and improves people's symptoms, but that hasn't been proven yet. Um, that's the only one that's easy to do because it's available. There is, of the investigational agents, there is a Gilead drug which was originally produced for treating Ebola, which turned out not to be effective at all for Ebola. But the early results have been very promising, and we have at almost all our hospitals trials going on. So within the next 2 to 3 weeks, there should be some data, not a cure. I mean, we can already see, but there is reason to believe that it might markedly decrease the number of people who have to be placed on a ventilator. And that would be a phenomenal thing, right? If we could, one of my more hopeful thoughts about this disease is many people do just fine. It's a relatively small percentage of people who do poorly. So we just have to move the needle a little bit. If we could get it off the ventilator, right? If this was a illness where if you got it, you would be sick for a week, sick as a dog, in the bed, but you knew you were going to get better, you weren't going to be on a ventilator, it would be very different, right? We would all be trying to avoid it, and who wants to be sick in bed for a week? But it's really the ventilator and the even smaller percent who die that really, puts fear in everyone and makes us so anxious. So I'd say a little bit of improvement, not a huge amount.
Have you heard about breathing exercises that can help seniors and immunocompromised individuals who might have COVID? That's from Marsha Goldstein.
Um, I have heard of it. I don't know whether it would help. I do think in general that people should exercise more, um, because part of why people who are healthier are getting through this better is they have better lung capacity. The part of why asthma or other respiratory diseases are a problem is people with those diseases, they don't have reserve. So when the virus infects the lungs, they don't have enough lung to get through the episode. So in general, the stronger your lungs and heart are, the more you're going to be able to get over COVID if you were to get it. So I hope that everybody, who's smoking sees this as another opportunity and reason to stop smoking or stop vaping. And that people who are not exercising say, hey, I don't want to get sick the next time there's a serious pandemic. I'm going to get myself into great shape, like Carlina Rivera. I'm going to do my exercise, and I'm going to build up my heart and lungs because ultimately that's the best protection.
Agreed, agreed. And this is my last question. And we're trying to help New Yorkers. I have a piece of legislation to open up the streets and close them to cars to give people more space to go out, to walk, to throw a football around with your kid, just to stretch your legs and get that exercise that is so, so important. So my last question, Dr. Katz, and I just want to thank you for all of your time. Incredible. Thank you so much. So you led the response in San Francisco to the HIV/AIDS epidemic. What were some of the lessons that you learned from that pandemic that you are applying today? And what are the biggest lessons we have to learn from the COVID-19 pandemic, both in healthcare and in emergency preparedness?
Oh, it's a brilliant question. I think to really know the answer, it'll take some time. But at my darkest moments in the COVID-19, when it seems hopeless, I do think back to HIV, and I think how much progress we made, and not just for HIV. I mean, the hepatitis C, for example, is now a curable disease. It never would have been cured had it not been for HIV/AIDS, because the medicine that we use for hepatitis C is a category of drugs that was developed for HIV. So it's not that it's the same medicine, but we learned how to build this category of medications. And so I always tell people, if you were cured from hepatitis C, you should go lay a wreath of flowers on the grave of someone who died of HIV/AIDS, because you owe them, right? They died and you got to live. And so I don't know all the things that we're going to learn, but I am always an optimist, and I believe that there has to be, you have to find what you can learn going forward. I think there will be things we learned. I know you and I were talking about the ventilators um, that the city is now able to produce. The cost of one of those ventilators is about $3,000. The cost of a ventilator we would typically buy is $50,000. Um, so then I think about all the places in the underdeveloped world where you can't afford a $50,000 ventilator. And I think, well, we built these ventilators in New York because we were afraid we were going to run out of ventilators. But now maybe we can use them in other areas of the underdeveloped world where nobody can afford a $50,000 ventilator, but where maybe a $3,000 ventilator, which is on a very simple design, will actually save life. So I'm hoping that from this horror of COVID-19, there will be other things like that that we'll get to, bring forward to help future generations.
Amen. Well, thank you, Dr. Katz. Thank you
Thank
for
you.
taking time to answer all of these questions. We got through many of them, so I appreciate your brevity in responses. And for those of you who are just joining us, I'm Carlina Rivera. I'm the councilwoman for the 2nd Council District. I have the honor and pleasure of working with Dr. Katz, President and CEO of New York City Health and Hospitals, the largest municipal health system in the United States. And he just answered many questions on testing, on PPE, on how to get better and how to take care of yourself most of all. So thank you, Dr. Katz. You are
Thank
very
you.
special to us, and I hope you have a lovely, lovely evening.
Thank you. You too. Best wishes.
All right. Just want to make sure. Then you press end meeting.
Leave meeting.
Yeah.
Leave meeting.
Hate to see him go. Hate to see him go, but he figured it out. Well, all right, everyone. Thank you so much for joining us. As you can see, Health and Hospitals has a good guy at the wheel. He really does care about his work. He still practices medicine today. Again, they're moving towards telehealth. And for those of you who maybe aren't necessarily familiar with some of the things that we're trying to work for and negotiate, I think that the expansion of telehealth services is going to be incredibly important going forward. Clearly, we were not ready to transition, especially for those who maybe don't have access to internet. About 29% of New York City households don't have access to online broadband. And then, you know, the language issue. But Dr. Katz, you didn't get to hear him, but he does speak Spanish. And he is also someone who is really trying to make sure that every New Yorker who walks into a health and hospitals facility feels welcomed and feels appreciated. Okay, great. So we're gonna go to some questions. I know we received some questions during the conversation. I'm gonna try to maybe bring another doctor back. I know having Dr. Katz again would be fantastic, but I did see some questions related to antibody testing, questions about people who are symptomatic. So we answered some of these. If you missed some of the beginning, this stream, this tape, this video, it's going to be available on our Facebook page perpetually. All right, so we're going to go to some other questions that I want to answer for people who are, I guess, used to coming together on Tuesday and just getting an update on some of the things that they heard, whether from the mayor or the governor or from a local elected leader, or maybe even from the news. I try to bring you as many facts as I can in this short segment that we have together. And if I can't answer your question, I will make sure to try and go back and get you the information that you need. So, all right, we're gonna start with a question from Tom Broswell, who asks, how safe do you envision going to the beach is going to be in the next coming months? So I want you to know that just as much as you all want to, I also want to go to our New York City beaches. I grew up in New York City, born and raised, and going to the beach was a treat, and it was certainly an experience, right? Not everyone can go away on vacation. So we would go to the beach, maybe we would go to Brooklyn, maybe we would go to the Bronx, and we would certainly frequent the local pool. So it's not in this question, but it is reported that we are going to have our local pools also closed throughout the summer. That makes me incredibly sad. I grew up across the street from Hamilton Fish, which is a large park and recreation center. And when they redid and reopened that pool, it was like the best news that the Lower East Side could receive in a long time. I would also go to Dry Dock, we call it 10th Street Pool. And that was such a great experience. I got to allocate some funding to improve that pool, and it's called Cool Pools. And we had this amazing day and a ribbon cutting there. And it was such a pretty place to kind of hang out and see family and friends. So to think that it might not be open this summer makes me really sad for families and for every kid that just in person that likes to go in and have a swim. All right, so the mayor has said that beaches will likely be closed this summer, but I do think that our beaches could potentially play a role in allowing New Yorkers to socially distance responsibly because they're large open spaces like our city parks. So if you've ever seen a picture of a really hot day in like Coney Island, you know it can get packed. But I think with the right type of regulation and people there and just overall messaging, letting people know just social distance, be responsible, and have a good time. So I think the biggest challenge is whether or not we can safely have people in the water while social distancing rules are in effect. And it's very important, regardless of what final decision the mayor makes, that for all New Yorkers to not be in the water if a lifeguard is not on duty. Okay? Just please be careful out there. We have lifeguards for a reason. So we're going to continue to monitor beach openings in the coming weeks, and we'll continue to update you all on any park closings or openings. As you have seen, parks are still open, playgrounds remain closed. That is for safety reasons. I went to Tompkins. I like to go around into the parks and check Madison Square Park, Union Square Park. People are mostly behaving. We had a really nice day on Sunday. I just want to encourage everyone, please, please, please be careful and distance yourselves. There's no reason why you can't just move from the next person 6 feet, please. So we'll keep you posted. Thank you, Tom, for that question. I do hope that we can figure out a way that we can utilize our beaches, and hopefully we can get you that answer sooner than later. All right, so Jason Tenzer asked, there has been construction in my building for several months now, and despite the ban on non-essential construction work, it has continued with noisy and dangerous renovations in empty apartments. What can I do to address this? I've already called 311. So DOB, actually, the Department of Buildings, has a real-time map of all essential construction sites. So if you're able to check the map and the construction isn't listed, call 311 again and let them know you'd like to file a Class A complaint for the Department of Buildings to address. Knowledge is power, right? If this site is listed as an essential construction site and you believe that it incorrectly received the permit, though, follow up with our office and we'll look into it with the Department of Buildings directly, okay? Again, I just want you all to know you can go to the Department of Buildings website, you can track essential construction sites, and if for some reason you don't think one is deemed essential, please let us know. Thank you, Jason, for that question. Okay, we're gonna go to the next one. I saw that you were introducing open streets legislation with Speaker Johnson. When will that take effect, and which streets will become open streets? So this is a great question. Thank you so much. Corey Johnson, who is the Speaker of the City Council, so there are 51 members of the City Council, and we vote for one president, one speaker, and that's Corey Johnson. You should follow him on social media. He and I are introducing legislation. I will tell you, first thing is we have to pass it. And before you pass a bill in the City Council, the process is you have to hear the bill. So we will actually have our first remote meetings starting tomorrow. We're having our first remote stated meetings. A stated meeting is when all of the members of the City Council come together and they vote on land use applications as well as legislation and other things like the budget, depends on the time of year. So we're going to introduce the bill tomorrow at stated, and we are going to hear the bill Friday, April 24th at 11 a.m. Again, you can actually stream these hearings at home. I realize, you know, not everyone is that tech savvy, but it's pretty simple to understand. If you need any help, let us know. So first, I want to say I'm excited that we're getting to do this. Unfortunately, there was a very small pilot program that the mayor started a couple weeks ago, which really didn't work out. The locations I thought were too small. It was too limited in scope. And we have to be really expansive when we're looking at this type of program. We don't want to make it some sort of destination like Summer Streets. And we want to do it in a real way where we're looking at spaces that have historically been closed. So we will look at locations where Summer Streets was initially implemented. But we're also going to look at sites that are adjacent to other recreational spaces, where we have taken recommendations from constituents, from some of my elected leaders, some of my colleagues, and we're also working with local stakeholders. So not just advocacy groups, but business improvement districts, community boards, Block and civic associations. We certainly want this to be community-led, and we realize that every neighborhood is not only different, it is not created equal when it comes to open space. So in order for us to go and stretch out and take that walk and get that cardio in, like Dr. Katz recommended, I feel the only way was to do what this legislative body has to do and move forward with legislation that really pushes this to become public policy. So I am excited. We have a lot of people emailing us about ideas. So we always take recommendations. In our district, we've had feedback for many years on certain streets that should be closed, even regularly as summer streets. I would love to have more summer streets program in my district. I certainly think Avenue B has always had potential to be one of these streets. And I know that we're always looking to create protected bike lanes and to be responsible, because I do believe that we need open space should be for the public. Open space should be for people. And this isn't just limited to open streets. We're actually looking, using technology that already exists to widen sidewalk space. So for those areas where people are maybe waiting for the bus or for some sort of transit, if we could potentially widen those areas and people just have more space to practice that social distancing that has been, I think, so instrumental in our success on finally reaching this plateau. Great. So thanks for that question. So we're going to go to a question from Leah Diaz. I have heard that the tests will be delivered to symptomatic people and other priority people. Okay, this is about testing, clearly for COVID-19. Will normal citizens have access to the tests maybe at a later stage? So Dr. Katz somewhat addressed this, but not exactly. So Leah, I'm going to answer your question. So yes, we certainly want everyone to be able to get a test eventually with time. As we expand testing and we have enough supplies, everyone should be able to get tested. The biggest challenge right now, as I mentioned, is getting the supplies, the swabs, the reagents. There's a lot of things that we need. Nasal swabs, testing reagents, and these are hard to come by because so many of these things are produced overseas and are facing unprecedented demand. So Dr. Katz covered that very briefly on how much they were paying for certain equipment that we realized we can actually make a lot cheaper at home. I know that's a little bit easier said than done, but since we're all competing for everything from equipment to food to just generally support, everyone is wondering what is going to happen in that next tranche of funding from Congress in the CARES Act 3.5, I think is the number that we're at right now. So we all know that funding for this has to be a part of the next CARES Act that Congress passes. I'm pretty sure they came very, very close to finalizing this next one. There will be money in there, I heard, for small businesses because they ran out of money for considering all the people that applied for relief. But I certainly think that prioritizing public health should come first. So I expect there to be some money in there. All right, thank you for your question. So next question is, the governor said this week that the state was sending masks and hand sanitizer to public housing, at least one per resident. I don't think this is enough support. What is City Council doing to take care of those of us in NYCHA? So that is true. There was a big announcement that the governor was sending masks and hand sanitizer to public housing. For those of you in New York City, it's about 400,000 residents. That's an estimate of people that live in New York City public housing. There are also other public housing systems throughout the state, clearly not as large. So for those that haven't really read a lot about this, the governor is looking to create a comprehensive program for NYCHA regarding testing as well, and then distributing those masks and sanitizer. That's actually a big step considering, because there has not been a concerted effort to focus on NYCHA. Many of these developments have apartments that are overcrowded, and I continue to think that we need to prioritize NYCHA as a city in terms of capital programs. When we talk about public systems, many times we talk about public transit and public hospitals even. Public housing is certainly, in my humble opinion, a part of our general infrastructure and should be treated that way and given the amount of funding that it needs. I was disappointed that the state included $0 for public housing. They need billions for their capital program alone. Over 40 billion is needed. But we're going to keep it moving and we're going to keep fighting because public housing is important. I was disappointed, of course, as I mentioned, that the state didn't include what was asked for by advocates, which was not for 40 billion, it was for 500 million per year for the next 4 years, that NYCHA and so many of us requested over and over and over again. I mean, I think there has to be a real investment. $1 billion a year is something to me that sounds a little bit more sustainable in terms of what we need. I also spearheaded advocacy last week to ask Congress to fully fund the NYCHA capital funding, because I think the best way to get people back to work is to actually even employ them in fixing NYCHA. There is a program, an employment program in NYCHA that just really hasn't been implemented well at all. And when we look at just our future and even how we should look at infrastructure, I mean, we should really be retrofitting these buildings, right? These jobs should go to local people. This is the Green New Deal for public housing that I feel like this is the opportunity for. I mean, I support that. I know many, many people do in this community, and I hope that we can make a reality sooner than later. All right, so I have a question from Rosita Bodnar, who emailed us, and she said, recently I've noticed an increase in the number of New Yorkers experiencing homelessness in the area surrounding my building. What should we do with regard to helping them find shelter during the stay-at-home order? Is there somewhere we can report? Thank you for your concern for our New Yorkers experiencing homelessness. That concern is shared by so many of us. Our office has been in touch with the Department of Homeless Services throughout the crisis. They've matched up their street outreach teams with clinicians to make assessments of street homeless for symptoms of the pandemic. We're also working to ensure that hospitals know that homeless individuals should not be put out on the streets, but rather we should have this interagency coordination with DHS to put them in isolation rooms that they've contracted throughout the city. So currently only extreme illness allows teams to force people into hospitals or clinics. So please know that the city is working on it. Social services confirmed just today that outreach workers have made roughly 14,000 engagements with homeless New Yorkers since the pandemic hit the city, resulting in 12 transports for those who exhibited COVID-19 symptoms. But clearly we have to step up. We have to do better when it comes to harm reduction. We need to provide mobile showers, hand washing stations, basic supplies. It should have happened sooner, but you know, this is the time now. I mean, we're looking at providing rooms. There is a campaign that I support to provide hotel rooms for our homeless individuals. You know, there are tens of thousands sleeping in our shelter system. There are thousands more that are on the street. You know, the homeless can't stay home. And I'm hoping that we could really ramp up what I think is necessary, which is to give them places to go even out in public where they can wash their hands, where they can find supplies, you know, just before it's too late. And I know that the city is moving to do this. And I know that the city council is also, we are pushing the mayor to act quickly. And we actually have legislation that we're introducing tomorrow to kind of push this conversation forward in a way it needs to happen now. All right. So I have another question from Rebecca Milvich. My question is, can we please ask the court system to pause eviction cases till 2021? What can we do if our landlord is withholding heat and 311 won't write a violation because I'm using the space heater? What do we do? Okay. Okay. So thank you for this question. a lot of people are worried about evictions. Um, there was an executive order by Governor Cuomo for an eviction moratorium, which was great. That was clearly in response to the advocates who organized a phenomenal campaign. Our housing advocacy in this city is incredible. The organizing that is done in some of our communities, I mean, that's where I come from. I continue to be in awe and absolutely inspired by some of the people who not only organize but are going through so much and continue to share their stories. Um, and I know that May 1st is around the corner, which is another day that rent is due. Next week, we're going to bring on an attorney from an organization that provides legal services to answer some of these questions right before the 1st. So I mentioned the eviction moratorium, which is really, really important, but we obviously must go further and consider all options to help renters, including passing rent freeze legislation in Albany. The city council does not really have the power to regulate rents, but we are trying to look at legislation to extend maybe payments. And we're also, pushing our colleagues in Albany to hopefully pass a bill that'll cancel it. So we must go further though, right? We have to consider all options to help renters. I support that bill that I mentioned. That's by Senator Mike Gianaris in Queens and Assemblymember Yuleen New from downtown Manhattan. That suspends all rent payments for 90 days for residential and small business commercial tenants that lost employment or were forced to close their business because of COVID-19. It would also suspend certain mortgage payments for landlords of these tenants. And it has 18 sponsors in the Assembly, 22 in the Senate. So please call senators and Assembly members and urge them to sign on. We want to get to a very, very high number there and let people know that this is something that New York City needs now. Just New York needs it now. Okay, so another thing here from Beatrice Torres Guzman. Hi, Beatrice. Thank you. Thanks to your staff for the wellness calls. I have spoken to 2 of your amazing staff members. Much appreciated. You're welcome. This is why I became a councilwoman, is to serve you all, to be there when you need us. I just want you all to know how much this community means to me. My team has been absolutely incredible. I can't do any of this work without them. We've called thousands of people. We have had volunteers from all over the city who have come by and help us, especially right here in the district. We've dropped food boxes and we have coordinated relief efforts, and to do these wellness calls, I knew was the least thing we can do for people, is to be proactive, is to start calling individuals who might need a hand. This was something we did right after Hurricane Sandy. This is what led to creating Lower East Side Ready. And this is the kind of service model that I will always put forward from my team. Constituent services take probably the most amount of time from most council members, for those that really, really take it seriously. So thank you for the note of thanks. It's always nice to be thanked. As I tell people, I take complaints, but I also take compliments. So thank you, Beatrice. And again, we're calling hundreds and hundreds of people a week, if not thousands. And I have some incredible team members who are getting this done. Cool. So Ruth Burgos is asking, in the building where I live, there have been 2 deaths. My question is, how soon will the apartment be released by the police? And what are the policies for cleaning and informing other residents when there is a suspected COVID death? Ruth, I'm sorry to hear about that. If you could please extend our condolences to the families. Each and every one of these people were someone's loved one, could be your friend, somebody you knew. And we've lost a lot of people. So that's always sad to hear. But if you email us with your building address, we'll follow up with NYPD. And to email us, you can email District 2, the number 2, District 2 at council.nyc.gov. Again, that's District DISTRICT 2 at council.nyc.gov. The city doesn't require notification of cases to other residents, and there clearly are some privacy concerns around that, around management or ownership, sharing information specific to the cases. So, but this is obviously concerning. We'll work with the city on this issue. And the CDC recommends that residents be put on alert, but that no specific unit info be shared. However, we have followed up with individual buildings where tenants want to make sure that common areas are sanitized properly. So please email us. All right, it's 8:30. We're going to take one more question. All right, I'm going to take this last question from Leah. She says, Carlina, how do you think that this crisis can make us, our community, New York City, our country better? Thinking about social policies and the environment. Well, I think there's always opportunity when you're faced with what seems like an insurmountable challenge. And I do think that this will allow us to take a little bit of I don't want to say a step back, but really to look at some of the policies that we're putting forward and how we deliver things like healthcare. How do we take care of our seniors? What can we finally do differently so that residents of public housing feel respected and they can live with dignity? And I also think that this makes a great case for universal health care. I know in New York State, we have some of my colleagues in Albany have a bill for a single payer system. That's a great start. But I truly do think that something has to be done nationally. Medicare for all is something I think that is the right thing to do. I think what you've seen just in New York City is how our hospital systems aren't really talking to each other, even over a month in. And I just feel like that sort of coordination is something that should happen, I guess, organically. And how you do that is that you level the playing field, is that you make everyone as equal as possible and you try to give them the resources that they need. Just what we've seen historically and what you've seen in the numbers in terms of fatalities from COVID-19 is that not every community is created equal. So when we're looking at social policies, why doesn't the South Bronx and East Harlem and Brownsville and why don't these communities have the resources they need to feel like health-wise they're being invested in? A lot of these communities we knew were sick, right? Hypertension, diabetes, obesity, asthma. They speak English as a second language. They're immigrant New Yorkers. There's so much more that we can do for these populations, for our undocumented New Yorkers as well. So how can just we treat people with more dignity? Why aren't we looking at how to make sure we're taking care of the people in Rikers Island? So I just think historically, people know that there is institutional racism, that there is oppressive systems. And so I'm hoping that this will allow us to think a little bit differently on social policy, on the way that we create and pass legislation. I think we'll be better for it. I think 7 p.m. is probably one of the best moments of the day when people open their windows and they clap their hands. And that's to show thanks. I think we're tough. We're a tough city, but we're also very, very, very thankful. Realize that people come here from all over the world to live their truth. How special is that? So I think that hopefully it will make us a little bit better. Maybe we'll have different leadership in Washington. People go to the ballot box and show their frustration by voting. But but I think it will make us a better community. And I think we're going to start putting in policies that are forward thinking, that are really looking at how we take care of communities. Public health is a part of climate change, and climate change is just as an existential threat as COVID-19. So I think these two things are certainly something that we should be focused on, and I'll be working on every single day. So thank you for that question. Thank you to everybody for joining. I hope you got some of you got your answers, some of your questions answered by Dr. Katz. And I hope that we can follow up, bring somebody else. Let me know if you have any ideas for the next few guests. Like I said, next week we are planning on bringing an attorney from a legal services organization to answer your questions on your housing rights, as well as what to expect from May 1st. So join us next week. I'm really, really happy that so many people tuned in, that so many people asked questions. Again, I'm sorry I couldn't get to them all, but make sure you watch the video, send your questions to us, and we'll try to make sure we answer them. And in the meantime, stay safe, stay socially distant, stay well, and stay classy. All right? Thanks, everyone. Good night.